I'm here with Dr. Stahl and Dr. Knowles, and we are going to talk about what cataracts are. So Dr. Stahl, what is a cataract?
Hey, Jess, that's a really good question. It's something everybody's been asking, talking about. When we were younger, our own natural lens inside our eye was clear, and you got good vision with that. But as you get a little bit older, that lens gets more dense, it gets more cloudy, it gets kind of yellowed, and your vision gets dim with that, and you just are not seeing very well. And the thing about cataracts is if we all live long enough, we're all eventually going to live long enough to develop a cataract. So it's a very common problem that all of us are going to experience at some point in our life.
All right. Dr. Knowles, how do I know when it's time for cataract surgery?
Very frequently asked question, as Dr. Stahl mentioned, the cataract will cause blurriness of the vision, degrading the quality of vision. When you feel that your vision is affecting your daily activities, reading, driving, hobbies, things like that, especially if you're turning on more lights around the house, you're replacing light bulbs, you're getting frequent changes maybe in your glasses prescription to get things sharper and it's just not working very well. Odds are pretty good that cataracts are starting to be an issue, especially age 50, 55 and up, that's going to be the case. And the key thing will be to get an examination, a full dilated examination, to be able to look at the lens that Dr. Stahl showed in that poster. And if the cataract is definitely there and is definitely the main cause of your vision decrease, then that is the time to get cataract surgery.
Okay. Dr. Stahl, what are some of the benefits of having cataract surgery?
Yeah, one of the problems with cataracts, of course, is that you're not seeing very well and you're not doing things. And some people give things up. Like some people, they stop driving at night because they're just not comfortable or they're tired of those thick glasses. So the benefit of the surgery is to improve your lifestyle. So not only are you seeing better, but some people are not needing their glasses as much. I'm going to talk about that in a little bit, but we have some lenses nowadays that maybe you're seeing a little better to drive without your glasses on, or you can use the computer or see your cell phone without your glasses on again. So the ultimate goal is to improve people's lifestyle and get them out of their glasses and functioning and doing their life a little bit more comfortably.
Okay. And Dr. Knowles, what if my cataracts aren't ready for surgery?
That's also a pretty common question, excuse me, that comes up. When you come in for your examination, we may see cataracts that are there, but even if they're not significantly affecting your daily activities, the cataracts are still there. That disqualifies you for LASIK. And so by the time somebody gets into their mid-50s or thereabouts, pretty much most people have some degree of cataract. And so LASIK is no longer an option at that point. And it may not be bad enough that the insurance would cover the cataract surgery. So they're in this in-between zone. And they may want to be getting out of glasses. They may be looking forward to having their cataract surgery because of the improved performance they can get from the new lenses. So in that case, they can actually have surgery. It's what we call refractive lens exchange. And it is where we take out the early cataract. It does allow them to have clearer vision, lasting longer, and having additional benefits from some of the advanced lenses.
Okay. Dr. Stahl, do I have to go to the hospital to have cataract surgery?
Boy, is that a good question for right now. This is a good time not to go to a hospital, right? So, one of the advantages of doing your cataract surgery here at Stahl Vision is we have our own outpatient surgery center here in the office. So the nice thing is people don't have to go to a hospital. We've said outpatient surgery, you go into the office in the morning, you get to go home the same morning. And it's just a much more convenient and friendly location to have your surgery than a hospital, which tends to be kind of anxiety provoking.
Yes. Yeah. Dr. Knowles, will the surgery hurt?
Great question. Everybody wants to know if their procedure is going to hurt, regardless of whether it's orthopedics or anything like that. But with cataract surgery, it will not hurt. We actually numb your eye up on the outside. We numb it up with medication on the inside of the eye. You are lightly sedated by some IV sedation, and it's generally a very, very comfortable procedure. Typically lasts 15 minutes, give or take a little bit. And again, you'll be a little bit relaxed. Many people the next day don't remember much about the surgery, and so they kind of like that. And so again, it will not hurt, and you're not wide awake during the surgery. You're a little bit relaxed, a little bit in la-la land is what I like to call it, but very well tolerated surgery, and people appreciate that.
Okay, great. Dr. Stahl, how do I keep my eye open, and what if I move during surgery?
Yeah, that's a real common concern that people have. They're afraid they're going to mess something up. And of course, we don't let that happen. As Dr. Knowles alluded to, you're lightly sedated, so you don't feel like your heart's pounding or that you're real anxious. We have a device that helps hold your eyelids open for you, so you don't have to worry about blinking. The surgery itself is only about 15 minutes long, so you're not in there a long time. And the reality is we're all breathing. We're still awake. We are moving. And truthfully, moving around a little bit isn't going to bother us during the surgery. So most people are still moving, and they don't have to worry about blinking. So they seem to tolerate the procedure pretty well.
Okay, that's good to know. Dr. Knowles, what are the restrictions after surgery?
Really, the restrictions after surgery are very minimal. One thing we do mention is no heavy lifting, i.e. maybe over 40 pounds for that first week. People want to know when can they get back to driving and things like that. We recommend don't drive the day after unless it's an emergency, but they can drive 2 days after the surgery. And again, other activities are being resumed pretty readily. So there's not a big interruption in their day-to-day activities. And people do very well, and they realize how simple it was and how minimally impacted it was with regard to their schedule. So they really like that.
Okay. And Dr. Stahl, do you do both eyes on the same day?
You know, we could, but we typically don't. And the reason we do one eye at a time is there's a safety buffer there. If we do one eye and then we see how the first eye does, and then there's also an accuracy difference. If we can do that first eye and then we wait a little bit and see how it turns out, sometimes we can make some adjustments before we do the second eye, especially with these advanced lenses we have, and we can tweak it a little bit. So it turns out we get a little more accurate results if we wait a little bit. Now, we don't wait too long because it's awkward having one eye done, one eye not. So usually 2-3 weeks apart from one another, and then people seem to do the best with that.
Okay, good. Dr. Knowles, what do I do with my glasses after I have the cataract removed?
Great question. Oftentimes, if you're having one cataract removed, it may be that your other eye also has a cataract, and that may need to be removed several weeks down the road. And obviously, you'll know that, and we'll go over all that with you. But people have differing powers of glasses, and it won't hurt your eyes to wear your old glasses, but the vision will be blurry with the old glasses in the eye that had the surgery done, because now you have new, better vision that is not requiring the glasses to be there for correction. So some people will pop the lens out of the spectacles on one side and leave it in on the other side. If they've got a really big prescription, they've been in contact lenses, oftentimes they can resume contact lens wear in the eye that has not had the surgery and wear those up until the time that they have surgery in that eye if it's going to have it. And so there's ways to get through that time period where you've got a little bit of a visual imbalance. You're getting used to the better vision in your new eye, and you're looking forward to getting the vision improved on the other eye.
Okay. And Dr. Stahl, do the cataracts come back after you have surgery?
Yeah, you know, the cataract never comes back, but for most people, over enough time, they develop a film that grows over the implant. Your own body's natural tissue healing over top of that, and that's easily fixable, and we can clean that off with a laser treatment. Most people will have that done at some time. It doesn't really put you back very much. So yeah, cataract never comes back, but we can clean that off sometime later if that needs to be done, and most people experience that. Okay.
And does surgery cover, or does insurance cover the surgery?
Yeah, that's also a very common question. People want to, make sure that their insurance is covered, that sort of thing. And the answer is it kind of depends on the type of insurance. And insurance will cover the cataract surgery when it's visually significant cataract, apart from deductibles and copays, which may change a lot depending on what type of insurance a person has. There are lenses that actually go beyond what the basic insurance will cover. And those are the advanced lenses. And the reason is that technology is marching forward, and insurance is kind of paying less and less, as I think people realize. And the technology allows us to actually use lenses that are not covered by the insurance, but they have extra bells and whistles and things that actually improve functionality for the patients. So insurance covers the basic aspects of the surgery, et cetera, apart from deductibles and copays. And depending on the lens that a patient selects, it may or may not cover that.
Okay. And Dr. Stahl, what is an advanced lens?
Yeah, 20, 30 years ago, the lenses we had pretty much were just one type, and they would set so that you'd still have to wear your glasses most of the time. But like everything else in today's world, the technology improved. Just like your cell phones have gotten a lot better, these lenses have gotten a lot better. And we have lenses nowadays where a lot of people may not need their glasses nearly as much. For a standard lens, most people are seeing reasonably well far away. Maybe they would need glasses somewhat. But we now have lenses that are able to correct some of your near vision, and we have lenses that are able to correct for astigmatism. And by doing that, a lot of our patients are able to drive and see TV and do things far away without their glasses on. And with some of these lenses, they restore your intermediate vision. So that's like using a desktop computer or cooking or seeing food on your plate or working in the garage. And we even have bifocal implant lenses nowadays that restore your near vision. So you'd be able to read, be able to needle point, see your cell phone without glasses. And unlike the bifocal in your glasses, which is only down here, these lenses are more like being a little more youthful, or like when you're a little younger, where you could see up here and here and here and there. So the idea is to restore a range of vision. Now, insurance, as Dr. Knowles alluded to, doesn't cover that. It's a self-pay sort of thing. But the advantage for people is a lot of times they have lens independence. They're not going to have to wear their glasses and contacts so much.
Oh, that's great. Dr. Knowles, is there financing available for these lenses or for surgery?
Yes, there is. Again, for the surgery, as we talked about, insurance will cover the surgery and the basic aspects of that, surgeon's fee, et cetera, that sort of thing. There will be deductibles and copays. For the advanced lenses that are not covered by the surgery, our goal is to make those as affordable as possible for most people. And so there are financing plans that are available that allow people to reduce the cost on a monthly basis, that sort of thing. There is some deferred interest options available and things like that. So our goal is to make it as affordable as we can for people so they can have access to the array of advanced lenses that are available.
Okay, that's great. So what's the next step for patients who want to have cataract surgery?
Yeah, the next step you're wanting to see better is come on in, and it's going to be one of the most thorough eye exams you're ever going to get. I'm going to look at you. And, if you've got a significant cataract, we're going to talk about your insurance will cover it. And sometimes people are ready to just go. It's like, I just want to get rid of these glasses. And so I want to have the same surgery just to be lens independent too. So we can work that out for people. So the easiest way is just call us at the office. And the office phone number here is 937-643-2020. And come on in and get a full eye exam scheduled. And for the most part, that exam is going to be covered by your health insurance.
Okay, great. Well, thank you, Dr. Stahl.
Thank you, Jazz.
Dr. Knowles, for answering everyone's questions. And
thank our crowd for coming to watch us.
Thank you for joining us
all.
this evening.
So,
All right.
thank
See you soon.